Hello there. What are these swellings on my dog's body? This is video 2 in a 3-video series that discusses lipomas, hematomas, and abscesses on a dog's body. I have aspirated clear blood from a lump under the dog's skin. What's next? Is a hematoma. So what? So what is a hematoma? A hematoma is just a pool of blood under the skin. A pool of blood under the skin. Trauma is the primary cause of hematomas in dogs. I classify hematomas into 3 groups. Oral or ear hematomas. And ear hematomas are triggered by painful middle ear inflammation or otitis that causes the dog to shake the head, scratch the ears, rub the affected ears on the floor, or bang the ear on the floor just to relieve pain. During those frantic attempts to relieve pain, dogs will injure the fragile capillaries under the skin of the inner side of the pinna, leading to pouring of blood between the skin and the underlying cartilage. So what are the clinical signs of ear hematomas? Clinical signs are linked to the pain in the middle ear due to otitis. You have swelling of the affected outer ear flap or pinna. The dog is shaking the head and scratching the ears. The dog is dragging the affected ear on the floor just to relieve pain. The dog is banging the head against the walls just to relieve pain. And how do you diagnose ear hematomas? Clinical signs are aspirating blood from a swollen ear flap are more than adequate to confirm an ear hematoma. How do you prevent ear hematomas? Have your dog treated very early for otitis to alleviate pain in the ears and subsequent self-inflicted hematomas. Note, hematomas will develop into abscesses if they go untreated. Hematomas will develop into abscesses if they go untreated. Recently, I have treated a cat with a very messy ear abscess. A very messy ear abscess. This was my first time ever to encounter an oral abscess in a dog or cat. All I have encountered before that is just ear hematomas, not ear abscess. How do you treat oral hematomas? The strategy is open and drain the blood. What are the surgical draining procedures? Number 1, I have my non-invasive procedure. This is my favorite procedure because it is easy to perform. I developed the procedure 6 years ago. Step 1, I sedate the dog with dexmedetomidine. Step number 2, I'll prepare the affected outer ear for aseptic surgery. Step number 3, I'll place some cotton balls into the ear canal to prevent blood entering into the middle ear. Step number 4, I'll punch 2 holes longitudinally from the tip of the ear flap to where the hematoma ends with a biopsy punch. This is a biopsy punch, right? You just punch 2 holes on either side of the hematoma. If a dog has a very large ears, you may need to punch 3 holes. All right. Step 5, drain all the blood and the blood clots. Step 6, place an umbilical tape between the 2 or 3 holes that you have punched. And this is what we call an umbilical tape. Yeah, this is the tape that you place between the 2 or 3 holes that you have already punched. because umbilical tape drain, right? I normally use this instead of a Penrose drip. Penrose drains, rather. Step 7, place some stitches around both the holes to stop any bleeding. Step 8, administer painkiller antibiotic and antibiotic injections. Dispense painkiller and antibiotic tablets for administration for 7 days. Step 9, I'll place an Elizabethan coral or cone around the head to stop the patient from removing the drain. Step number 10, I'll schedule the client to return in 4 days to remove the drain. Invasive procedure. I performed this procedure more than 6 years ago before I developed my non-invasive procedure. Instead of punching 2 holes, I used to make one long longitudinal incision from one edge of the hematoma to the other one. I would then drain the blood and blood clots. After that, I would close a large open wound with a through and through or dart sutures or stitches. Through and through stitches are run through the skin on the inner side of the inner flap. Then the needle goes through the cartridge in the middle and the skin on the outer ear of the ear flap. The procedure wrinkles and deforms the outer ear after healing. That's why I don't perform it anymore. That's the end of the video. If this video was helpful, subscribe, share it, or comment below. Thank you for watching, and see you in the next video.